Thanks everyone for joining. This is our second conversation of the fall semester. We have a brief introduction for those of you who are new to the Center for Design and to the things that we do. So I don't know, Michael, if you want to share your screen with the slide deck. And then we can introduce the conversation specifically.
So welcome to the Center for Design, whether you're here or online watching us. I'm Michael Arnold. I'm the interim director. Paolo Cucciarelli is on leave this semester. And we have also with us Stefania Siliota Cehare, who will be moderating today's event. And if you are wondering what the Center for Design is, it's this place where we can bring people together. It's also a platform to help incubate interdisciplinary collaborations between the creative disciplines that exist in CAMD and other parts of the university. And it's a hub to the greater community, so we can have opportunities to bring in outside organizations. Some of these have been the city of Boston, different organizations around the community. We have collaborations with internally in the college with architecture, journalism, but also externally throughout the university with computer science, healthcare, mechanical engineering, robotics, etc. We host all kinds of projects, hackathons, virtual reality demonstrations, games sessions. Am I missing anything? There's a lot that we do, as well as this series of conversations. In the fall semester showcases some of the projects that are funded through the Center for Design seed grants, which is a small grant supporting the development of initial research that will likely lead to a later and more robust project. Oh yeah, I was supposed to go to that slide there. So these are some of the conversations that we've hosted in the past, including COVID-19 information design, where we host a library of graphics, graphical representations. There's a couple great ones coming up too, that look at, there's ours right there. There's a couple great ones coming up, one in just a couple weeks on the 20th, looking at legal design. And then we have another one, I think it's on December 9th, December 8th, thank you, with Pierre Valery, entitled The Urban Griot, which is a very interesting practice. A griot is kind of a an African folk musician that is also a teacher. So he's looking at developing technologies to create a urban griot here in the US. It'd be very interesting. That's just a little bit about the Center for Design.
Yeah, thank you so much, Michael, for that introduction. And with no further ado, let's get ahead and start this conversation. As I mentioned, it's the second conversation of the fall 2023, and we'll be discussing tech-driven transformation, revolutionizing early childhood mental health. So this project is one of this year's 3 funded fellowships at the Center for Design, like Michael was describing. And it aims to develop and pilot a smartphone-based application to be used as part of a technology-enhanced family partner model for early childhood mental health services delivery in the Boston Healthy Start initiative. The purpose of this project is to improve effective communication between the family partner and families, support guided experiential learning, and decrease the gap in screening, referrals, and services for economically disadvantaged children with social, emotional, and behavioral difficulties. So let me introduce our panelists and speakers today. We have Beth Molnar here, professor of the Department of Health Sciences in Bouvet College, and she's the director of the PhD program in population health. She's a social and psychiatric epidemiologist, and her research is grounded in three public health domains: social epidemiology, prevention science, and psychiatric epidemiology. Her focus is on violent traumatic experiences, the social context of high-risk behaviors, and development and evaluation of violence prevention and early childhood mental health interventions. We also have Michael Arnold Mages, Interim Director of the Center for Design, an assistant professor of the Art and Design department in the College of Art and Design. His research interests include developing a rich understanding of the ways that service design, technology, and the material environment facilitate human conversation. Herman Saksono is an assistant professor at Northeastern University with a joint appointment at Curry College of Computer Sciences and Bouvet College of Health Sciences, and his interdisciplinary research contributes to human-computer interaction and digital health equity through his social health informatics research agenda. The goal of this agenda is to investigate how personal health informatics tools can catalyze social interactions that encourage positive health behaviors. And last but not least, we'll be having Christy Mullen, the director of the Center for Early Childhood, the Home for Little Wonders, who will be sharing her experience of what it means to have a family partner working closely with families and organizations. So I'll pass it to you, Beth, so you can go ahead and start.
Thank you, Estefania. Well, and thank
you.
you to the Center for Design for supporting this project. I am somebody with two young kittens, and one has decided to join us. So we've been working on this topic in my research lab for more than 12 years now. We've been thinking about ways that we can enhance the services that children who are already before age 8 showing social, emotional, and behavioral difficulties. How can we enhance those services in a way that gets kids the attention that they need sooner and more effectively? And we've been doing this in partnership with the Department of Public Health for the state of Massachusetts, as well as the Boston Public Health Commission, which is the public health department for the city of Boston. And so Christy had led the program at the Public Health Commission until relatively recently. She's going to join us, and like was said, she'll give us some examples of how this enhancement with technology could be helpful. But if you could go ahead to the next slide, Michael. So what started out as, can everybody hear me okay?
Yeah, it sounds great.
Okay, great. So how this started was the Department of Public Health and the Public Health Commission, they invited us at Northeastern to be the evaluators of what was a new model of taking in the darker orange box somebody with lived experience with special healthcare needs or special mental health care needs of their own children, and hiring that person in the role of family partner, which is a type of community health worker, if you've heard that more frequently, with an early childhood mental health clinician. So somebody who is usually a master's level clinician who can provide therapy and has special training to especially look at the problems of children under 5. And so those two people, they were introduced to community health center pediatric practices. We had 3 practices that we were where that was being implemented and integrated into pediatric primary care. And the service delivery was designed to be very holistic. So they did a lot of case management in addition to mental health treatment. So, helping families with issues that they were having about, toilet behaviors or applying for kindergarten or, all of the things that parents or caregivers and families that face a lot of vulnerabilities could use some help on. Everything was always very family-centered and focused on health promotion and prevention of any future disorders. So all of that was linked together in what is called a medical home model. And so the pediatrician would refer kids in vulnerable situations to the team. They were called the launch team. And that team would meet regularly, usually for a year or more with the family. And us as evaluators, we did a lot of data collection. So if you could go to the next slide, Michael. So we looked at the records that the providers were keeping on the children and on the caregivers as well. So we asked them to share with us the records of things like parental stress and parental depression, as well as the social, behavioral, emotional scores from some validated screeners with the kids. And then we had a series of evaluation pieces like a parent satisfaction survey, a launch provider survey. And then we also took a look, at some Mass Health data, Medicaid data, to see if we could also tell if these services were lowering costs of care as well. So all that data was fed into our launch evaluation team, and we had some really nice success. And we can go to the next slide. So we saw over, a year of follow-up, some really significant declines in shown here. We also had some other results on the children 6 to 8. But you can see here that in the blue bars, which is the baseline, all but the infants, so that's age and years across the x-axis, all the blue lines are above what we call the clinical cutoff at baseline, except for the infants. So we were hoping that would come down, and that is what we showed. So in the yellow and the green lines, you can see that those are now mostly below the clinical cutoff. So on average, the kids were no longer in the clinically concerning range of those screeners about their behavior problems and social emotional issues. So that was great. And we were able to show some of these same changes in the parents too. Next slide. So at the top is the improvements that in the parenting stress measure. So again, the green line at the top at time 1, on average, the parents were above the clinical cutoff in parenting stress, parenting related stress. And then you can see the nice decline we saw as we moved along to times 2 and 3. And then also in their depressive symptoms. So again, above the line at time 1 and below the line on average at time 3. So all of this was really great results to be able to call this an evidence-informed or evidence-based program. The next slide. And so it's now in the database of the maternal and child health programs, MCH Bureau. This is an award that it received the year it went into the database in 2020. So it was deemed the best new practice of that year. And so now, all of the materials are online and people can download those materials and implement it in their own practices and such. And after that, what we did was we expanded and we did the same kind of services across Massachusetts in another grant that the Public Health Commission was able to get. And then in the most recent one, we've been trying a similar model in the child welfare system. And now we just got funded for another 4 years where we're going to expand it to some home visiting programs. And this is where we've planned for the next phase to, think about what we can do to make these services even better. As we expanded, it was harder to reach everybody. We didn't see as clean results as we did the first round when it was more tightly controlled, which is often the case when you're doing prevention science. As you get bigger and expand to more diverse kinds of settings, you sometimes need some more. So we've been talking for a long time about the ways that something like a smartphone app might enhance the work that this kind of team can do with families. Increase communication, increase access to information, create more community. We've often nicknamed it, having a family partner in your pocket for the families. And so that's where we're at right now, is we've teamed with this wonderful group of collaborators, and I can pass it next to Michael to tell you about some of the ways that we're thinking about collecting data, and the ways that we are at the moment collecting data and getting started in a process with how something really unique and consequential can be designed to enhance these services. Thanks.
Thanks so much, Beth. What we're planning with this initial research to develop the preliminary data that we need to take this further into development is a two-stage research process that's both user-centered and participatory in order to develop and test the smartphone app. So this is divided into two phases, and this first phase is really kind of an information gathering, figure out what the user needs are and develop that, and then there's a second phase that is developing a complete prototype and evaluating that. I'll talk about those just briefly. So the first phase of which was what we're in the midst of right now and recruiting for, is to conduct exploratory, qualitative, face-to-face interviews with 20 dyads, and then these dyads would consist of both a family partner and a caregiver. So this might be a parent or whoever's really directly caring for the child. And using a semi-structured, in-depth, open-ended interview process to develop a set of opportunities, challenges that these folks might face, specifically those that are related to communication and support providing. We're looking for support and how this app might better support adherence issues in therapy practice, as well as support better emotional and social well-being for the parent, the child, and maybe the caregiver as well. So from this initial stage where we develop the sort of requirements document that helps us format and frame the feature set of the application, we'll develop an actual prototype using one of the common prototyping softwares, showing the features, demonstrating how this could actually work in real practice, and we'll circle back again to the same community and evaluate this in a usability and acceptability format where we show them the prototype, they look at it, they play with it, they imagine the use of it in their day-to-day life. So we're looking forward to getting hard data on whether this will be acceptable to the community to help them in these kind of difficult and challenging moments. So data gathered from this stage will serve as, and there's the pizza coming in. Thanks. Data gathered from this stage will serve as preliminary data for a broader funding proposal to fund the complete development of the app and a robust testing protocol in years to come. And I believe I'm turning it over to Herman to talk a little bit about the specifics of what we imagine we're going to be developing.
Should I move there or? Okay, people can speak there.
Yeah, you can. Yeah.
No.
Here, I'll turn this so you can see.
Thank you.
Easier. So you can push the button.
Oh, awesome! Exciting. So yeah, we are. We've been brainstorming several features for the app. One of them is note keeping for the parent to keep track of their children's development and then use that data to have more deeper conversation with the family partner. We wanted to incorporate videos from other caregivers to support parents to learn from each other using videos and audio. We're interested in developing information sharing in a group chat. So it's for family partner, like the more experienced parent to invite other parents to share their experiences in supporting their kids. And then we also incorporate interactive social activities so that to give reasons for families to engage with these features. But all of these features are not set in stone. These are like our big ideas, and it really what we learn from the work that Michael will do to better inform how can we implement this better. We might end up with different approach, but this is our big ideas. And we sit with this within the NIMD framework, the National Institute of Minority Health and Health Disparities. So the NIMD recently released, not recently, 2019, released a framework on how to develop research intervention to reduce health disparities. And they divide the kinds of intervention that you can do by 4 levels of influence: individual, interpersonal, community, and societal. And in 2019, they found that a majority of the grants that they give to other researchers, 91% are focused on the individual. That means there's a lot of opportunities to intervene at the interpersonal, community, and societal level. And this is why I'm very excited about this project, because we're trying to intervene at multiple levels. And now NIMD require all grants to intervene at least 2 levels. So I'm excited with that direction. So the way we envision it is that the note-keeping feature to be shared with the family partner is intervening at the interpersonal level. This is giving tools for parents to have a dialogue with the family partner, and then they can support, and the family partner can support the family functioning at the interpersonal levels. And the videos from the caregivers, information sharing in group chat, and interactive social activities, we are intervening at the community level. So we are hoping that we can create like a community of health where community members support each other to be healthy and potentially detect potential concerns before it becomes like a severe concerns. And other slide here. And the reason why we're doing this also is that we want to reduce the risk of intervention-generated inequality. It's a concern in tech, but it has been a long-standing concern in health. So one example was smoking from anti-smoking promotion. Like in the 50s, smoking levels were more or less the same at the educational level. So like people with higher education and people with lower education have like more or less the same smoking levels. But then there's a lot of like federal and state programs to promote people to smoke less. And the numbers are going down generally, but then if you divide by educational attainment, it shows that people with higher education smoke less compared to people with lower educational level. And this suggests that a lot of interventions tend to be more effective for people who have the means to be healthy. And this is something that we are also concerned that is happening in health technologies. So, and one of the suggestions to reduce intervention-generated inequality is we should do user-centered design, obviously. And I think the NIMD approach in doing multi-level intervention and having community members, having family partners involved in health as a collective effort, I think that's another important direction to have. So that's a brief of a few, and we're hoping that we could like develop new ideas on how to support interactions social interactions that facilitates healthy behavior. And I will pass this to
Christy is here, yes.
I am here.
Yay.
Hey, everybody. So I get the most fun part of the presentation because I get to talk about real families and real situations where this app will make a difference. So these are stock images and not real people's names, obviously, but real scenarios and real situations where family partners have helped families in the past that this app would be a benefit to. So this is Sally and Sarah. Sally's a single mother. She works at a childcare center. Her daughter, Sarah, is 13 months and has a lot of special medical needs. So a parent who, like Sally, works in a childcare center, knows a lot about child development, knows a lot about how to tell other people where their kids are at in the developmental expectations sort of world. But when it comes to her own child who has different needs in addition to her developmental needs and has to try to think more, like could use this app to really help her think about her child's strengths and to document things. And when she's in that place where she's feeling like, why can't my kid be normal? Why can't my kid be like everyone else's kids? Why is it so hard for me? She can look at this and think, well, actually, look at all the things that Sally has done. Sarah, sorry. Look at all the things Sarah has done in her difficult but amazing first 13 months. So the note keeping part of this app might really help a family like Sally and Sarah. And then we have Reggie and Ron. Reggie, a single father who wants to do everything he can to raise his son, who's 22 months old, who is strong and clever, and in Ron's words, incredibly active and always getting into mischief. And something like the community videos might really help Reggie normalize his child's behaviors. And maybe the pediatrician can tell him 100 times that 22-month-old children do get into everything. But if he goes and sees in the videos someone else with a child who reminds him of his child and reminds him of himself as a parent saying the same thing, that might be a very different way to support a dad or anyone who's questioning or wondering if their child is outside of the norm or too active or too into mischief, or wondering how to use their child's natural inclination for risk taking as a bonus, not a problem. So the videos would be a place where someone like Reggie could catch a minute here and there and get some influence from his community about his parenting. And then we have the idea of the group chat. And this is a scenario where we have one family partner who's working with 3 different parents, and they're all talking to their family partners separately about feeding issues and if their baby's eating enough and if they're feeding their babies the right foods and when do they start cereal and when do they wean and when do they do nursing versus bottle feeding. And to have an app where someone like Claire can say, hey, let's all talk together about this, could really help families build their social networks, but also build their confidence in their own abilities to talk about their challenges with parenting. And then it helps Claire do her job better because she's not the only person saying these things to families, and it's not all her expertise and her wisdom, but it's also Carl talking to Carrie about something he tried that worked, or Carrie talking to Cam about with her older child when she went into using cereal, and the group chat with the facilitation feature, right? Because you can do that on Facebook. You can do that in a lot of places. You can get a lot of group input out there in the world. But the idea of this is that there's a facilitator and that it's very protected, that there's not 100 different opinions, but there are 4 opinions. And there's someone like Claire who's trained to help parents interact with each other and exchange information in a way that doesn't result in information overload or cultural inappropriate contact and all of those things. I think that this would be, as a person who raises a lot of babies, I think this would be so helpful to help filter through the noise of Facebook or any other group chat function. And then we have a family like the Green sisters who are being raised by their grandmother, and their grandmother has already raised her kids, but what raising kids was 20 years ago is so different than what raising kids is now. And something like an app that tests your knowledge, that proposes the information in a way that you're interacting with it and not just reading, or not just having the pediatrician tell you over and over again, here's what you should be doing, but rather a fun, interactive way to build her own confidence in her knowledge, and also to sort of confirm and deny what's new, what's different, what's the same. And then in a scenario where you're trying to figure out for 4 kids at each at developmentally distinct age ranges, that's a lot to keep track of. And it's something like this app on your phone that in a moment where you're thinking, wait, is this what a 2-year-old should do, or is this what a 4-year-old should do? You have it in your pocket and you can refer to it and you can say, oh, look, I was right, and feel good about it. Or, oh, look, I wasn't quite on target, but now I know that this is a slightly different way of thinking about raising children and thinking about potty training, or thinking about timeouts and spankings and hand slaps and all the things that parents maybe 20 years ago did without, in a context where that was a normal, healthy way of parenting. And now we know some different things about parenting. And especially in a situation like Jeannie's, where DCF is around her family and she's really needing to parent in the most socially acceptable DCF approved way, an app like this might help her keep track of what all of those new pieces of information are about parenting. So those are just 4 hypotheticals, but I hope that it kind of helps you see how many different situations and many different cultural problems or family problems might be helped by this app that we're going to build. And I believe then we're open for questions.
Thank you, Christy. Thanks, everyone. I think you're right. Actually, I don't see any questions right now on the chat, but please feel free to place your questions there, or we're now open to the audience. If you guys have any questions about the background of the project, or the future of the project and the application, is there anything in person or online that you may want to address?
We actually have we have a couple in the room here. Eva, do you want to?
Sure. Yeah, so it's a very interesting project. So really nice to hear about that, and also about your user-centered participatory approach. And I was wondering, are you also considering, for example, inviting users to participate in ideation, concepting, prototyping? Like, what are your ideas? Are you considering this at all?
Yeah, the current plan right now is that the users will participate primarily in the ideation phase. So that's really what this the first phase of the project is oriented towards. And ideation from the point of view where the parents have a lot of expertise. So like, what kinds of things, what kinds of moments do I really need support? When did something happen that like I needed to reach out for somebody? We're going to take that data, bring it back to the studio and try some stuff, try some design stuff. So I think that piece of the prototyping, or that piece of the evolution will be done primarily by, you know, expert design folks. One of whom's sitting in this room right here. And then we'll circle back with that prototype in the second phase to the community, where they can validate this, disagree, say, oh, you know, we told you I'd need support in, you know, in this particular moment, but not that way. You know, we're like, wow, that really, I would have never thought I could, you know, my child's having a tantrum, and what I really need at that time is a checklist on de-escalation techniques, because you just, when that happens, you just, everything leaves your mind and you can't think. So it might, you know, we hope that they'll be really intimately involved in the development. But I think like the prototyping phase will probably be just, I don't know, done, you know, kind of offline from the parents and caregivers, parents and family partners, caregivers and family partners. Sorry, my language straight. Yeah. Did I, Beth, any? That sounded like a me question.
Yeah, I would just say that, you know, we've been having discussions about how much of that do we do now with our pilot work, or how much do we build that into the first year of the bigger grant when we're having an opportunity to make lots of refinements. So we'll be doing it in both phases, having lots of participatory input on both phases.
Yeah, I think that actually links to a question I had. The prototyping and participation of real users or potential real users would help a lot in the co-design of this app, or this technological support enhanced capabilities that you're trying to develop, especially since you mentioned different case scenarios or different users of this application. And for example, new parent, a young parent with a first newborn versus the grandmother that you were talking about, you know, they may have different challenges in how they use and they interact with the application itself. So it would be interesting to also like incorporate this as part of the design process. Do you have any thoughts? I guess that links to another question that I had, in how this app will support data protection of the users. And you mentioned a facilitator that will be like behind the scenes, kind of like curating the content. Can you share a bit more how you envision this will play out?
Herman, could you take that one?
What I was thinking too.
Can you repeat the question again? I was processing.
Yeah, I guess maybe it's a two-part question. So one is like the participation of different kinds of users and designing for different scenarios. So like a young parent versus a grandmother that is taking care of the kids now. So like these are completely different users with different ways in which they interact with technology, distrust, technological challenges and stuff like that. But on the other side of the coin, in the back end of the application, you were describing having a facilitator that will go over some of the content and make sure that, you know, the content that is posted for people to use is going to be accurate. And, you know, so on one hand, it's like, how do you envision this will really work in real time? And on the other side of the question is also about how are you thinking about the protection of the data of the people that will like share videos and stuff, and the notes of their own kid? How have you think about this, and like how are you going to go about that?
Yeah, thank you for the question, and thank you for clarifying. I really appreciate that. Yeah, I think so. The first one was like the participatory design part, and I think it's a very interesting question. It's sometimes I find participatory design to be challenging, and I know my colleagues who are working with low-income older women, they don't appreciate the process of using like craft tools and papers to design, because we are adults and we're dealing with other difficult situations, and this woman asked, like, why do you want me to play children's stuff? So that's the tension that I saw in participatory design, and I'm open to any other comments or feedback on how to approach this. But I think it's really important to capture all of the aspirations of the parents and the caregivers. So that's the first part, the answer to the first part. And then the second part was about you know, we want to support social interactions, and we want to make sure that the information that are being shared in the app are appropriate for the families. And in the past, what I've done in the past is there's always some level of moderation. So when somebody shared a content, it has to be reviewed by an expert before other people can see it. So that's another step. And then in another approach that I do was that people might accidentally disclose personal information, like that's a security and privacy concern. So we need to put like some tools to support people to be attuned that they're not disclosing private information. And that could mean like just a note, several notes, like please don't share personal information, like your age, your home, the name of your kids. And that, but I think that needs to be done in several spots. And then in terms of data security, I think a lot of the server tools are pretty secure, and we will use like standard security measures. But to my knowledge, the world of security has moved from like technical security towards user-centered security, because you can do so much in the technical side, but it's eventually the user who are who play a large role in security and privacy. So I think probably not in the study, but in the next iteration of the study, we need to examine what are the potential disclosures that could harm the parents and the caregivers' privacy. So that's my answer. I hope I captured all of your questions, and let me know if I didn't.
Yeah, I was thinking about like the differences, the nuanced differences in users, you know, between that grandma and the early parent, and can we effectively serve them through one interface? And I think that's, you know, one of the things that Christy pointed to really nicely in the talk, when she was talking about these you know, this opportunity for group chat and for community support, that there isn't just one answer to anybody's question. You know, there might be, you know, and designing that in such a way where there's like 4 or 5 answers at play that might each represent an appropriate, you know, both like a health appropriate response, but also maybe like some cultural nuance between those different responses. And I also, one of the things that I don't think we mentioned is we're also planning to have this app available in different languages. And I think, you know, as kind of one of our early interviewees pointed out to us, this would need to go beyond just translation, you know, of the English version into the Spanish version, but really thinking of, you know, what is particular to this community, and when you know, when we're providing this content in another language, that entails providing it to another culture. So I think there's some nuance there to be unpacked, as that we hope to discover in these early phases, and also hope to support throughout the project.
I have something to add if we have time, or if there are other questions.
Yeah, and I think Beth wanted to add something too. So please go ahead.
I just wanted to say, if there's anybody in the room, we just opened up to temporary positions to have some people come and help us with these dyad interviews in Spanish and in Haitian Creole. So if you know anybody that might be interested in being an interviewer for us in one of those two languages, get in touch with us at that ECMH Northeastern email address.
We have one question in person.
So I want to know how the app integrates cultural tailored content. For example, like the group chat thing, or the one where Claire, the medical professional, talks to a group of people according to their questions or inquiry. What happens when, for example, I'm an Indian. What happens when an Indian family is looking for some support in terms of our cultural thing? Would that medical professional also be able to provide that? I'm just giving an example for Indian, but there are a lot of other cultural things, and families and parents do believe in that. So would that profession also be able to provide that?
I can answer that from the standpoint.
Maybe Christy wanted to.
Yeah, or maybe Christy could go ahead first, but I've been talking a lot.
So it's a great question, and it's a great challenge that this app might be able to solve that we haven't really been able to solve in the real world. So family partners are a special kind of professional, and their whole purpose is to use their own lived experience in helping parents. So they may not come from the same culture, but they may be able to say, you know, when I was raising my kid, the pediatrician told me that I should feed them this way, but that's not how my grandma taught me to feed, and that's not how my mom taught me to feed. So I didn't listen to the pediatrician. I did what blah, blah, blah did. And there's that like nuanced answer that doesn't exactly, you know, doesn't mean that they know everyone's culture, but means that they know how important culture is and how hard it is when your culture conflicts with the dominant society or medical sort of influence. And that I think this app can absolutely do. And I think that when, you know, Herman said experts reviewing content a little while ago, and whenever I hear that, like my hackles go up, because we want to really think hard about expert in what. So expert as a doctor, expert as a parent, expert as a member of the community. All of those pieces matter. And I think this app can be a place where we tie that together. And I was thinking of one specific example, which was when a family partner was asked by a pediatrician to come talk to a family about co-sleeping. Co-sleeping is a huge cultural issue in sort of medical facilities. Like we know that co-sleeping is dangerous and that we have to say, don't do it. But in this particular situation, the pediatrician had been telling a family over and over again, don't co-sleep, don't co-sleep, don't co-sleep. And the family kept doing it. And when the family partner came into the conversation, she said to the pediatrician, can you talk about how you're managing this? Because she knew that the pediatrician was also a mother who was having a really hard time getting her kid to sleep in their own bed. And so this app can almost be that person who says, wait a minute, let's step back and think about this from multiple angles. And in that scenario, in that conversation, the mom was able to say to the family partner, and the pediatrician then learned that they were living as a family, husband, wife, baby, in one bedroom of a multi-unit apartment. And so when she was saying, don't co-sleep, the mom was thinking, well, the baby's right next to me and there's nowhere else for me to put this baby. And so when you tell me to shut the door and let the baby cry it out, what door? I don't have a door. But mom had never been able to share that before. And so I think this app can also be that like communication, it's almost enhancement, right? It's like it makes the professionals slow down and listen differently. And it gives the family an opportunity to say things that they might not usually feel safe saying because they don't always have a family partner with them. But now they will. They'll have a family partner in their pocket. I hope that helps sort of think about how this app might solve that cultural challenge that we face.
And it's a super important point too, because design, right, the profession of design and designing these apps generally works by rolling things up into big balls, you know, and then treating everything in that ball in the same way, right? So, you know, everybody gets the Facebook, you know, everybody gets the Instagram, and those are like sort of frozen, you know, frozen aspects that are applied across everybody, regardless of, you know, their cultural background, perspectives, values, beliefs, etc. And really, the only plan from the design side has been, you know, well, we'll have Facebook and we'll have Mi Gente and we'll have space in the Chinese version of this. The Chinese social media.
WeChat.
WeChat, thank you. Oh my God. Yeah, right. And that's, you know, and that's how we'll, you know, we'll roll people up into smaller bowls, you know. I think this, but I think the nuance can come in a more directed way.
Yeah.
And we got a small audience. Do you guys have any suggestions? Do you imagine are there any features you would imagine, or like do you have any experience caring for kids and you were like, oh, I had this situation where
I don't have experience caring for kids to that extent, but I do have experience with kind of provider care through an app. And I think it's an interesting experience because I don't know if I would necessarily say that I felt as supported sometimes because of kind of that. There's a bit of a buffer space that you need to give them in order to get back to you. So I'm wondering, like, maybe if this has shown up in previous iterations, like what is that expectation of the users when they go into the app for interacting with their partner or whatever provider they might have?
is that like a time, like I send a text and then 30 minutes to get a response?
So it's more like I will have to select a provider and I get this disclaimer that says please allow for 3 to 5, or I think 3 business days for them to get back to you. And sometimes that's fine because it's not an emergency, but if I can't reach anyone any other way, then it's a little bit of a stressful situation for me as a patient. And I can imagine if you're you need to talk to someone and you're a parent that's stressed out about something that's happened with your kid, it's probably not as much.
So I don't know about from the design, the techie part of it, but from the human side of it, the relationship between a family partner and their families is a little bit different than what you describe in terms of going to the app to find a provider. So one of the ways that I envision people using this app is with their known providers. And they are family partners and the families they work with, they already have this, like they already text each other. They already do all of that. But what makes this part, what it brings to it is more planning and intention to the conversation. So I don't envision them, although humans do what humans do, right? So I had not envisioned this as a place where someone would go and seek new contact with a new human, but more planned contact with their already assigned professional. But it's an interesting question of whether or not parents might use it that way.
So that definitely makes sense. And when I said I go find my provider, I mean like one of the providers that I've already been working with in the past. So they're not like new to me, or I'm not searching like a hospital network. It's more that providers that I've had relationships with. So, but what you said makes sense in the way that it's not meant to be like that main line of communication, more so as like a kind of like a shared workspace for whatever, issue you might be dealing with the kid or some other, goal that you have in mind for their care.
Yeah, that makes sense. I'm thinking about how I like go through the online medical record to talk to my not my pediatrician, my primary care doc, and then like 4 days later they call in the prescription for me. That kind of scenario. I definitely don't want to create an app that makes people feel like that.
I don't know,
And
this is
that there. Sorry.
Oh, sorry. Like I was on a medication and I just wanted the answer, like, I had a splitting headache and just needed to know, could I take some ibuprofen while I'm on this medication and it's like maybe it was like 2 medications and this other, and it was like, the only person to ask was the physician, I felt. But yeah, 3 to 5 days to get back to you in that situation when you really want a response like within maybe 30 minutes. Sorry, Beth, you were gonna.
Oh, no problem. I was gonna add that, over time, hopefully our library of other conversations could also be helpful more quickly to somebody that consults the app.
I was going to add in thinking about these features or the future interaction of what the app may look like. I guess maybe for Christy and for everyone in the room too, like how, if we think about 20 years from now, like thinking about all the technological developments and all the things that can happen, what do you think the ideal interaction looks like in order to help parents support their children better? How do you think this can evolve, or like what do you envision this support will look like in an ideal world?
That's a really tough question. I appreciate you asking it. My immediate pop into my head was that this may be like sacrilegious for the audience, but that we rely less on tech and more on like relationship, that the tech is about building relationship, not about replacing relationship. So we still need that human interaction, just like we were talking about waiting for your doctor to answer you isn't the same as when your grandmother used to be able to call up the doctor and just like he'd talk to them or he'd come by and see if their head hurt, right? So like that we use the tech to go back towards more interactions between humans that are in real time, that develop relationship, that understand culture and sort of transgress all of the challenges in the world between persons. So I guess that is what I would want in an ideal world. I don't know if that's like a hologram following me around of my family partner, but I hope that we don't let tech replace interactions between people, whether it's real life people or tech created people.
No, I agree with you. I think the role of technology is to amplify the strength that people already have. So it's not that technology will replace the family partner, but it will strengthen the relationship between the parents and the family partner. And also I want to add that 20 years from now, I would be really interested to see community members as, I echo what you said, Christy, like community members, they have a lot of knowledge on how to be healthy and how to manage a healthy lifestyle. And I hope that technology could also amplify their knowledge and their expertise to complement the medical space.
Yeah, I don't know.
And I would add that, sorry, Michael, once again.
I'm talking up, please.
So I had, the privilege of being in a mom and baby group when my son was an infant, and 2 of those moms are still really close friends of mine 15 years later. So I feel like the community that gets built by this process could also, again, be a human consequence, not a technology one.
I was thinking of like some of these families that experience like diaspora, and you know, maybe they're not got an opportunity to talk so frequently with mom or grandma and get that parental advice. That, you know, like a community-based thing like this, or even, you know, I don't know, it's not like if grandma and mom could feed a large language model that you know, gives appropriate suggestions, you know, culturally appropriate suggestions through an AI, you know, I mean, that sounds maybe repellent, but like if you know, if the source of the data were my town, you know, that I came from, and it might offer a way to be connected to that. I think that's that's exactly what you're, you know, the amplifying, how can the tech amplify my humanity? We'll see.
That just made me think how neat it would be if we could actually, as agencies that operate services, employ people as virtual family partners who are back in whatever country that someone has recently immigrated from. So like could actually do some employment, and then the family partner is in the app, but they're actually sitting back in the place that folks here came from.
I love it.
Yeah, because I think in a way too, in thinking about that cultural piece, and please correct me if I'm wrong, but you were mentioning that you would like this app to primarily support disadvantaged communities. And in so doing, what kind of like, is there a particular ethnic group that you would want to focus on at this point, or where would you like to start your pilot? I think.
Is that a me question?
Yeah, group question.
So I can say that the communities that we have implemented family partners in are primarily lower income, non-white communities, lots of recent immigration situations, housing insecurity, social instability, those sorts of things. But I don't think that is because this wouldn't work for other communities, but rather that we've chose to start where there is the most need, and that is where we've started. But I think the idea of a family partner actually came out of the children with special health care needs, which has obviously always been not based in any particular socioeconomic group or racial group or geographic group. So the family partner is useful to everyone. Mm-hmm. But our funding has focused on communities around Boston and Worcester and Springfield that need it the most. And I don't know about this app.
Yeah, because it makes me think about, maybe it's not a question, but more so a comment, but makes me think about this interplay between being physically in one place, so being a new immigrant in the Boston area, for example, but having still roots and cultural mindsets placed somewhere else, and how can this conversational support app have this interplay between being physically in one place and having to adjust to this context, this new cultural context, and also wanting to bring this background and lived experiences from the other place. So how can this help and support people that are going to use this app and helping develop these children by being physically in one place, but having all this cultural mindset and background on the other. So I guess maybe it's not a question, but a comment and a consideration to have.
Yeah, it's a great idea.
One of the questions. So maybe the app could also have a feature where you have videos or audiobooks or anything that would solve common problems for families. For example, if they cannot reach the pediatrician or the professional at that time, and they really want someone to help them, and Google is not something you should take help from. So maybe some common problems that would help them solve it instantly. You know, some videos to help them, not just community videos, because community videos also are very specific to personal people. They would put on videos of what they feel. Maybe some common problem videos where the family could actually get help from.
Yeah.
Almost like an FAQ.
Yeah, maybe.
Yeah.
Yeah, because if you put on a feature, for example, a Twitter kind of feature where, or maybe a Quora kind of feature where you just put questions, there are going to be a lot of opinions, and it's going to confuse the family member anyway. And if they cannot reach anybody, there should be a FAQ video section or something where they could actually find a common problem. And if that really, maybe it's like, I don't know how to make my child stop crying. And it's just a common problem. Maybe the video can help them, and they cannot reach somebody at that time. That would be helpful.
Yeah.
That's
That
great.
would be a way to get different cultural voices into the
Yeah,
app as well.
That could be specific. Then you can have a filter for cultural specific videos as well. That way.
Yeah. Trying to write
I think
this down.
that is a really good idea. And in addition to that, as I'm a part of the project now, as we approach these pilot studies and the participatory sessions and interviews, I think what may be interesting to think about is within these groups of people and users specifically, everyone learns differently and everyone has different ways of communication that may impact differently the way in which they interact with the application. Or for example, maybe the way in which I understand content better is by talking to a real human. Someone else maybe audiobook, someone else maybe video, someone else maybe activities, because that's some of the things that I think Herman showed in the prototype. So I think taking into account these different ways in which people like understand content would be interesting to test as well. Is there anything else from the in-person audience that, or comments, questions that you may have, or online?
Yeah, I was also thinking, kind of building on what you were saying. On one hand, it might be very interesting to make it very personal, because it's also important to receive that personal attention as you're dealing with these issues, I think. While for some other people, it might be important to feel kind of anonymous, maybe, because it might also be maybe tricky to ask for help. You might experience some like shame, like, oh, I should maybe know how to resolve these issues by myself, and it might be so difficult for some parents to ask for help. So I think that might also be an interesting balance, like to what extent should it be very personal or also allow for some like anonymity. But I'm not sure if you already thought about that. No.
It's a nice point. Thank you.
Yeah, we haven't discussed that in depth, but I think that's a great idea. And this notion of anonymity is such a complex topic, but how do you support anonymity, but then also support productive conversation, like healthy conversation?
And human connection.
Yeah. So I think there's like just a lot of access to that, and potentially we can explore that.
Yeah,
deeper.
but I think some kind of gradated, like the zero entry pools for babies, where you could just walk in and you don't get scared because it's that much water, then that much water, then that much water,
Right,
and then by the time you're up to here, you're like, well, I just came all that way. So maybe there's something there that we could do with But I hear you about I might be ashamed to post this question, to reveal I'm struggling.
Yeah,
As a
I
parent.
worked on like a kind of similar project in the past, but that was for parents with mild intellectual disabilities. And for them, like shame was a really big part of, we created like this kind of robot that they could ask questions to, and also like keep repeating, asking the same questions over and over again, which might be like difficult to keep asking a human the same questions over and over again, because then they might feel judged or like ashamed of not knowing. So I was just curious, like maybe that's an interesting thing to explore for you.
No, I'm just thinking, because I saw a similar paper that that kind of, that there's results, and the idea of the online health communities is that's a big topic. So I think we can contribute a lot in that area. Thank you for that, another insights.
I don't know if I have any insights, response to your insights, but I like this very much. Thank you.
Maybe something silly to bring up, but I search for solution for stupid stuff on YouTube all the time, and when I realized that there are actually millions of people are trying to solve the same problem better.
Right.
So I feel we need to address that issue, maybe through the videos
Right.
aspect. I'm not sure yet, but
Mhm.
it's just like something just came out, like I'm searching on YouTube and looking for answers, and I found out people are actually don't know this as well. I'm not the only one. Maybe to give this kind of impression with the app, to ease the shame.
Right.
Yeah.
People.
At least there's a work on online health communities on women sharing their experience of being harmed, and that kind of space can be an opportunity to shift the stigma. So that's another thing that we can do.
Yeah.
Shifting the stigma through the app, through collective conversation.
But I think it's also, like that some things that may seem very basic,
Right.
the existence of a video or a Q&A or something that addresses this, something that might seem very basic,
Right.
is validating
Right.
on some level. Like, oh yeah, look, other people.
Right. And if other people can comment and say, oh, I was dealing with the same thing, that's so validating, right?
I think also having, a trusted moderator, we've had that in mind for a while too. Like, for all of us who go searching on Google for whatever answers to our questions, like knowing that the family partners out there to step in on the community conversations and provide some, additional information or resources, I think will build trust and confidence for people in the answers that they're looking for.
Well, you mentioned Quora and Reddit, and they have that upvoting, downvoting schema, which I think maybe it might be better to have something like, I have had this problem too, and this solution worked for me. It's like like frame the voting or frame liking or something.
When you're like online shopping and there's reviews on products and it's like X number of people found this review helpful, like how many people found this article or this video helpful.
This helped me. Yeah.
I like that. Sort of makes me think of the been there, done that kind of framework that when we're in talking directly to people, we get a chance to say.
Right.
It's nice.
Thank you for clearing the notes, Michael. We got a lot of great feedback.
I don't know if it's legible to anybody but me, but designer notes. So.
Yeah, I hope this was helpful for the team and for the audience as well to interact in this manner. I don't know if there are some closing notes from either of you, Beth, Christy, Herman, or Michael. If there are no more questions from the audience.
Oh, just that we'll be happy to hear any further ideas anybody has. So Michael can share that last slide that had the project's email address again, or you could email me directly. But thanks for the conversation and the seed funding and the opportunity to hear some great ideas today.
Yeah, thank you everyone for your time. We'll be happy to keep the conversation going, like you mentioned, and also brainstorm about different opportunities for supporting you and the project and the development of the project. I've heard great ideas about participatory design sessions and co-design sessions, so maybe we can think about those as we go forward. So thank you for joining us today. We have a couple more conversations that are going to take place, one in November and one in December. So stay tuned for the next ones and the future events. And please stay connected to us and keep the conversation going. So thanks again for joining us today. Thank you to our speakers, Beth, Christy, Michael, Herman, and the audience here. And thanks, Julie and Ashita, for putting this together.